Namaskara. I'm Dr. Sunita Rana Agarwal from Dr. Agarwal Hospitals, Bengaluru, and I'm an eye surgeon. Along with that, we do medical genomics. And I'm going to talk to you on retinitis pigmentosa. This is a congenital disease. It is usually caused by a mutation. We have already found out more than 200 mutations on different sites of the DNA. For example, there's a very common DNA which is 90% associated with retinitis pigmentosa. We call it RP. Here it's called RPE65, which is a particular gene which produces a particular protein. This gene, definitely 90% of RP patients will be affected with it. Whenever there is any congenital error, more than 90% will be affected with retinitis pigmentosa. So what is it? This disease is a disease of the retina, and this disease is caused because the retina is not able to remove all of its melatonin out of the eye. How do we see? When light enters the eye, there's a particular visual cycle that goes on, and this transfers this light energy into electrical energy, sending it to the brain, which we perceive as vision. In doing so, there are pigments associated in the retina so that extra light can be absorbed and only what image we want to see remains clear cut in the retina. This light absorption is done by the melanin in the eye, and the melanin has to get secreted out, taken out by certain cells of the retina and thrown out of the system. However, when this does not occur, the retina gets spiculed with this kind of melanin all over. Along with that, the optic nerve goes yellow, waxy, into optic atrophy, and the blood vessels that come onto the retina become thin and attenuated. So we have three signs for retinitis pigmentosa. 1, the black spicules on the retina. 2, the yellow waxy disc, and the thin blood vessels. Now, as the patient starts growing in retinitis pigmentosa, he slowly goes blind. Usually, it starts at about the age of 10. By the age of 20, his vision is very much down, so he has only the central vision left. By the age of 40, he's completely blind, or he may just have some amount of tunnel vision. This kind of vision going down, if it is less than 15 degrees, we have already told that this is a visually impaired person. So these are the patients who go in for visual impairment. How do we diagnose the condition? Like I told you, we look at the retina. However, today we have another better diagnosis, which is called NextGen sequencing, where we can find out what are the mutations, where have the mutations occurred on the DNA, and are they causing retinitis pigmentosa. If we have diagnosed the condition as retinitis pigmentosa, we may be able to treat it. Today, we take 1 drop of blood, his own fetal DNA, own fetal stem cells, injections to the patient. So if we have moved him back in time, we have also tried to remove that problem to a certain extent. Over the last 20 years, we have found that certain amount of mutations are corrected by this treatment. So if the patient had optic atrophy and wagners and he had certain other base pairs abnormalities, these got corrected. So we do know that today we do have an answer. We may not be right there. He will not get that vision that you and me enjoy. But yes, he will definitely be better than what he was. And maybe he just won't go blind.